Did you know that Blacks mistrust the healthcare system? As a physician, I am going to share the reasons why. Let me start by telling you about my dad, William Curry. He is a 99-year-old World War II, Korean, and Vietnam War veteran, a man who has personally experienced the era of segregation in the U.S., a man who fought in a segregated military in World War II for a country that didn't allow him to use public restrooms unless they were Negro only. And even after fighting in 3 wars and sustaining serious injuries, had to fight for years just to get his medical needs covered by the VA. We are not talking about generations back. This is my dad. He not only lived through these experiences, he also witnessed events like the government-endorsed clinical trial called the Tuskegee syphilis study, a government-sponsored program that tricked Black men into suffering the terrible symptoms of syphilis for decades under the guise of a treatment plan, a study that knowingly withheld available treatment with penicillin for almost 30 years while watching them slowly deteriorate from the disease. While the syphilis study is one of the more well-known events, it is only one example of historical and yes, even current events that contribute to Black communities' mistrust of our healthcare system. There are still many systemic racial practices and policies in place today that need to be addressed if we are going to give equal, quality care to the Black population. For instance, let's look at how we assess kidney disease today. The predominant practice is to add a marker for Black patients that shows their kidneys as healthier than non-Black patients. This marker makes no sense. Black kidneys and white kidneys are exactly the same. A Black person can donate to a white person and vice versa. This practice leads to poor health outcomes for no other reason than it's what has always been done. Even if it seems harmless, eClinical Medicine Journal found it is keeping 31,000 Black Americans off the kidney transplant list. It is keeping 300,000 from qualifying for a nephrology referral and keeping over 3 million outside the threshold for stage 3 chronic kidney disease. This practice seriously impacts Black Americans' ability to access equal health care in America and is a glaring example of modern institutional racism. And this is just one example for one organ in the body. Look at the 2016 study published by the Proceedings of National Science, which found 40% of medical students believed that Black patients felt less pain than white patients, that their nerve endings were less sensitive, that they had thicker skin than white patients, which helps explain the 2015 study by the Journal of American Academy of Medicine that showed Black children received less pain medicine than white children for an appendicitis. Couple this institutional racism and biases with the fact that we continue to see underfunding of community hospitals located in predominantly Black communities. It starts to explain why Black people are dying at a disproportionately higher rate from preventable diseases than our white counterparts, as found by the British Medical Journal. Honestly, the question isn't why don't Blacks trust the healthcare system? The question is, why should they? Again, go back to my dad and you can see the mistrust. When the COVID vaccine became available, he instantly said, I'm not taking that. I'm not going to be their guinea pig. They just want to test on Blacks. When you are a minority, you build an unspoken fellowship. It's born out of a common set of experiences, through similar challenges and backgrounds, through a common understanding of how society works, not only how it works, but how it works for you. Or in this case, how the healthcare system doesn't work for you. So how do we fight against generational beliefs and years of mistrust? How do we break this cycle? Through representation. Representation is key to help bridge the divide, to break down those barriers and start growing a foundation of trust. Representation makes it easier to trust someone from your community, someone that you believe will hear your concerns, understand your situation, and make you feel cared about and understood without judgment. If a Black person that mistrusts the healthcare system can find someone in healthcare that they see themselves in, someone they can relate with, it opens the opportunity to build trust. In this case, those physicians have a tremendous responsibility. They must provide care to the most skeptical patients. They must provide care that will evangelize the benefits of quality healthcare within their communities. This will help break the cycle of mistrust. That is why we need Black doctors out in the field, providing great care and calling out institutional racism and biased practices. Just a few weeks ago, I was sitting in a healthcare webinar where best practices were shared with doctors to help them understand current policies. And in the middle of the presentation, the speaker indicated that providers should use one medication for Black patients and a different medication for all other patients. None of my colleagues seemed to show any concern. But for me, I was screaming inside. Why were Black patients the only ones to get a different medication? This is a simple example of how Black doctors can bring a skeptical eye and highlight racially based practices and policies. The representation of Black doctors in this country is low. And in a male-dominated field like medicine, it is crucial to grow the number of Black female physicians. We need more Black female physicians to show anyone can be a doctor, so it can be seen as a viable option for little Black girls. So more Black women become physicians and provide quality care to the communities that they serve. Now, becoming a physician isn't easy. It is one of the most difficult professional achievements a person can make. And rightfully so. Physicians are trusted with a person's most precious possession, their health. It takes years of hard work and dedication. But even now, after pushing through and accomplishing this great feat as a doctor, as a full-fledged physician, I am often not met with the same acknowledgement and respect that my colleagues are. I cannot tell you how often people simply refuse to acknowledge I'm a physician. Hi, I'm Dr. Curry-Winchell. How can I help you today? Oh, I'll wait and talk to the doctor. And it's not just patients. Even in business and administrative meetings, I will get called by my first name, while a white doctor standing next to me is called doctor. So, Dr. Smith, what do you think about this policy? And then a minute later, bio, what do you think? Now, it might seem trivial that I get untitled, but it shows that I'm not viewed in the same light as my colleagues. That even now, in 2022, my status is not held with the same prestige as my white male counterparts. So what can you do? Learn about the history of healthcare in America and its impact on the Black community. Support programs that will grow the number of Black female physicians, such as Black Girl White Coat or Association of Black Women Physicians. Encourage Black girls to aim high and let them know they are valued. If we ever hope to bring equal healthcare and treatment to the Black community, it must start with equal representation in our healthcare systems. And unfortunately, we have a long way to go. In 1864, there was one Black female physician, just one. One out of more than 54,000 physicians. Her name was Dr. Elizabeth Crumpler. Today, there are about 17,500 Black female physicians in the US. That is roughly 2% of the more than 877,000 physicians in the US. We have moved the needle some, but Black female physicians remain drastically underrepresented. To reach an equal standing, our numbers would have to triple so we could achieve the 6% we represent in the general population. I am proud to stand in front of you today as part of that 2%. But I hope in the near future, I can stand in front of you as part of the 6%. And that when I enter a room, patients and colleagues will hear me when I say, I am Dr. Curry-Winchell.